Well, the University of the University of Tennessee Health Science Center plays a pivotal role in Memphis health industry.
They're all about Memphis health and Tennessee health. Joining us today is this well-dressed physician named Dr. Peter Buckley, the Chancellor of the University of Tennessee Health Science Center, who just recently was appointed to the steering committee of the Alliance of Academic Health Centers International. The list of Dr. Buckley's accomplishments and accolades would take the rest of our time to tell you, but know this: he is CEO of Tennessee's only public academic health center. That's 6 health science colleges, 4 academic campuses, multiple hospital partnerships statewide, and hundreds of clinical training sites all across Tennessee. So, welcome, Dr. Buckley.
Thank you, Joe. Thank you so much for being with the opportunity today. We are indeed privileged to serve this great state.
Well, we're glad to have you with us. So how do you think that your new role in the steering committee of Academic Health Centers International will help further health science studies here in the city of Memphis?
So it's not unusual for people to get opportunities to be involved in national and international activities. And it's also not unusual when you have that privilege. You often take away more than you give, right, and then you have the opportunity to bring that back to your home environment. So being in dialogue and learning from people all over the world will help also what we do here in Memphis and also in the great state of Tennessee. You know, I have a different voice than most other people. I'm an international medical graduate, and 23% of the doctors in America practicing are from overseas. They're international medical graduates. So there's an opportunity for us to learn and come together.
Definitely.
Well, a native of Cork, Ireland, but a U.S. citizen now for many decades, so we're thrilled about that. You're currently in year 2 of a 5-year strategic plan to help improve the health of Tennesseans. How are we doing?
Well, first of all, we've got a direction that we didn't have before. We've got a vision that's really easy to remember. It's 4 words: healthy Tennesseans, thriving communities. And it's also a vision that's statewide. And part of what we've been doing is recruiting new leaders to that vision and to the strategic plan that you mentioned. And so we've been busy doing that, and it's been a combination of building the leadership that is within the organization, as well as adding new leaders, some local, like our Chief Business and Financial Officer, Raj Karapathy, and then, as you know, Joe, kindly been helpful bringing international and national leaders. We've just had our new Dean of Medicine of the College of Medicine complete his first week with us, a second time around Dean. And we've been building out, whether it's in the colleges or in communications or in development, really a whole new team.
Right. And UT Health Science Center recently earned the R1 designation from the Carnegie Classification of Institutions of Higher Education, which signifies the highest level of research activity. How does this R1 designation a game changer at UTHSC?
So it's a stamp of approval from an independent national organization that we've got the credibility and we've got the capacity to conduct cutting-edge research, and we're already doing that. We're almost at $100 million in research for this past year. We're doing not just cutting-edge science, but science that matters for the human condition, and we're specifically doing work that matters for people in the state of Tennessee, whether it's issues around child mental health or child care, or whether it's issues around the heart or the brain or cancer. These are common conditions in Tennessee, and we're right on top of research across the state.
You are a psychiatrist and a widely published one, internationally known. You've written hundreds of scholarly articles. Dr. Buckley has authored or edited 20 books on schizophrenia and related topics. The world, it seems, is paying greater attention to our mental health, especially when celebrities like Olympians Simone Biles and Michael Phelps reveal they're struggling. When the door opens to these kinds of conversations, it's an opportunity to normalize our talk for all of us about mental wellness, right?
Oh, you're so correct. Celebrities having difficulties, you think they stand on a pedestal, but then they show a human side. And when they step out and do that, it's not only therapeutic for them, enabling them to get care, but it also has this extraordinary ripple effect because it allows people to recognize that mental illness is pretty much in everybody's family, Joe. And so it gives that opportunity for dialogue and also potentially for other people that are otherwise maybe not going to come forward to see that they could come forward and get care. So it has a great impact, not just in awareness of mental illness and conditions, but also stimulating people to seek care that mightn't otherwise.
Right. And undoubtedly, there are thousands of people in need of mental health care, a struggle with mental wellness. But if they finally do reveal their issues, sometimes there's no place for them to go to get the care they need, the resources to pay, or to get professional help. What would you encourage those people to do about getting help?
So sometimes it can be a struggle. And there are a number of things you can do. It's great to enlist the support of your family. It's great to enlist the support of your neighbours. It's great to enlist the support of a other professional. So even if you have a physician or somebody else that isn't specialised in mental health, docking in rather than going on your own or waiting or giving up because you can't find those resources. So having people that care about you, whether it's your family, your community, your church, or your other providers, enlisting their help can help get that breakthrough. Also, there are resources directly available. We are fortunate. There is a fantastic Department of Mental Health in the state of Tennessee. You mentioned, Joe, I'm fortunate to have more awareness of what's around the country. This department is a stellar department and works with communities to make sure that there are both wraparound and emergency services. We're fortunate to be involved with Alliance Healthcare. This is as good an organization as you'd find anywhere in America, and their doors are open for anybody, anytime. That's the kind of resources. So a little bit of support, a little bit of looking, and it is there for people.
Indeed. And the Alliance, in fact, opened a brand new mental health crisis center, which is located on Summer at Broad, right there in the community. And so if you're in need of that kind of help, it's right there for you 24/7, in fact.
Correct.
Dr. Peter Buckley, the Chancellor of the University of Tennessee Health Sciences Center, a joy to have you with us today. And we know you are building a team striving for excellence at your institution, and we are going to be very interested to follow you and this team that is growing at UT.
Thank you for the privilege.
Yes, sir.